Good afternoon and welcome to Aquatic Physical Therapy. This is your training where normally, of course, you'd be here in the pool. But what we try to do today is bring you aquatic physical therapy in the water and show you some of the basic principles. You'll see on your handout sheet that on the PowerPoint that there's going to be blanks, and what I'm going to ask you to do is to either chat among yourselves, you guys filling in the blanks pretty much what's happening there. I want to introduce myself. My name is Melody Medley Keith. I'm a physical therapist, and I'm also certified in vestibular therapy, concussion therapy, as well as aquatic physical therapy. And we have been in business 20 years at Lakeway Aquatic Physical Therapy. The facility that we're at right now is Nitro Swim, and we want to thank them very much for the use of this pool so that we can come in here and bring you this information about aquatic physical therapy. So just kind of giving you background as we start, the water. We all kind of are drawn to the water. I always think that the water is just some place that it gives people a lot of just solitude and things like that. I have a master's degree in psychology, and there's a lot of background on just how nice the water is for your psychological issues and just to calm the central nervous system down and things like that. That's why a lot of people love to go to the beach, listen to the water, things like that. So the water has great healing properties in it, and it always has, way back from the 1500s when they learned about the history of aquatic physical therapy. And it actually started in Bad Ragaz, Switzerland, where what they did was they had this warm stream in their village, and they learned that if they put people in the warm stream and held on to them and let them just float on their backs, and someone held on to their shoulders or their head, that the warming properties and the movement of the water helped people feel better and get over ailments that were ailing them. So again, there's history going way back for aquatic physical therapy. That's kind of our basis, our history of that. So, but for today, what we want to kind of bring in today is more of evidence-based practices of physical therapy. And again, what you're going to be looking at today, we're going to try to show you all the equipment that we use. So just like on the land where, you have different size of dumbbells and barbells and weight and TheraBands, we also have that in the water, and we're going to be showing you that and explaining you that. So I think one of the biggest things that I like to explain to people is that that aquatic physical therapy is not a modality, right? It is a therapeutic exercise. It is billed as 97113, and we bill that as all-encompassing billing code, where in that you'll see we can do upper body, we can do lower body, we can do balance, gait, we can do neurological issues, we can do all kinds of manual techniques in the water. So that is all billed as 97113. So it is not a modality, it is actually a therapeutic intervention. All right, so again, the two implications or indications that I want to put a patient in the water. Why would I want to put a patient in the water? Well, of course, all of you are probably saying, what's the first thing? And you see the blank there, right? Probably because they have weight-bearing restrictions, right? So a person comes to you and he's 50% weight-bearing or 25% weight-bearing, and what are you going to do with him? Well, in the water, I don't have to worry about that. So with weight-bearing restrictions, I can do a lot with them. The second one is with pain or inflammation. If I have a patient that is in a lot of pain or has a lot of edema, then I am going to put them in the water. And we're going to talk about why I would put them in the water. But because of the natural healing powers of the water and the process of the water, that's why we do it. And again, because Lakeway Aquatic Physical Therapy, we always say rehab faster with less pain, because people that are in a lot of pain can come to the water and they're happy. So, okay, so as we try to progress them, a lot of the questions people ask me is, well, do you just put them in the water? No, we have a whole land area that we have over on 620. So we do, most everybody, it's either a one land, one water, sometimes all land, water. It really just depends on the patient and what the patient's goals are. So if the patient's goals are to try to get the inflammation down and take the pain level down, and they want to come to the pool 4 days a week, they're in the water 4 days a week. And so that's where the plan of care would suggest that. So really, it's just depending on what kind of patients that we have. And you'll see through this that we have all kinds of patients. Okay, we have all kind of patients that come through the door for aquatic physical therapy, and we put pretty much everybody in the water. All right, so going through my notes, making sure that I've got it. So we're going to start, our next one is just our physical properties of the water, right? And your physical properties of the water, of course, are buoyancy, hydrostatic pressure, viscosity, and fluid dynamics. And we're going to go through those. Thank you very much.